Okay, what's up, y'all? Just about to go market, talk to some doctors, and I wanted to bring you guys along the journey. Biggest thing about what I do, a lot of things is I talk to people, network, let them know how we do things and how we care for patients, and so bring you guys along here for the day. All right, let's go. Alright, so I'm on my way to go see a doctor I've been working with for a while, and I was just thinking, like, I think when it comes to marketing, well, healthcare marketing, this is my opinion, and this is just from experience, is that healthcare marketing is all about developing trust and integrity, which is just carrying out your word. What you say you're gonna do, you do it. And I, as the administrator, CEO, could say, oh, we're gonna do this, this, and this. But if the nurses and the therapists don't carry that out, my words are nothing, right? And so a lot of times, you know, in the healthcare industry that I'm in, which is home health and hospice and veteran care, you get a lot of different administrators that just come in and come out, and they're here today, gone tomorrow. And what happens is you have to kind of like rebuild trust over and over and over again, which makes the doctors frustrated and makes the facilities frustrated. And so what I try to do is establish just a long relationship. And, you know, you're not going to get, you know, business right away. That's any type of sales or marketing. You know, you're there to figure out a need and figure out a solution to help solve a problem. And, you know, one of the things that is, it's easy to go somewhere, and then if you get business and you're excited, then you just think it's going to be that easy. That's not the case. Everyone has a problem, and everyone needs a solution, and your job is to help solve that problem for them. And a lot of times, you know, you may go and say no to someone or something, or they may say no to you, and that no just may not mean, you know, that no to you as a person. They're good right now. They have most of their problems solved. But the job of you as the quote-unquote salesperson, or the one that's coming to provide a service and to serve them, is to help them see that they do have a problem, and they may not be aware that you may be the solution. Because a lot of times we have so many decisions that we make, and problems and things, and we may not know or may not be aware of it. And so the job of a salesperson, or the job of a leader, or as you're scaling a business, my job is to be the chief salesperson, because my job is to help the company grow. And so what I focus on is making sure I have the right people on my team. If I don't have the right people on my team, then all the things that I say are null and void. It doesn't make a difference. But if what I'm saying and what my team is doing, if they line up, then that's where trust is built over a long period of time, and then business is created, and you're able to serve more people. So, you know, that's kind of, in a nutshell, if you were to say marketing when it comes to healthcare. It's trust, and it's time. It takes time. Like this one doctor I'm going to go see, it took me probably 6 months just to have him, you know, trust our team and trust what we do and how we do it and how we respond. And I mean, it takes time. It really does. Of course, you're gonna, you know, you may not be perfect, but it's just consistency. It's just showing up and adding value and providing a need and carrying it out for that person. So yeah, that is, I mean, in a nutshell, that is sales. And that's sales. It's marketing. It's about solving problems and adding value. So, and trust. You gotta have trust in there. Oh, another thing, you've got to be able to relate to people. Like, when you're talking to someone, it's better to do less talking and just meet them where they're at. You're not gonna try to like get something from them. I mean, let's go back to, if you were dating someone, right? It's courting. You've got to take like 6, 7, 8 dates for them to be like, kind of like this guy, or kind of like this girl, like she's interesting, right? It's not going to be right off the bat unless it's like love at first sight. It's not, I don't know. I don't know. There's some people like that. But even though it's love at first sight, it's usually love at first sight for one person, not for the other person, right? So, it takes time. It really does. And so if you're able to do that and take your time and get to know someone and develop that trust, you got to be patient, and you've got to, and then if you're trying to meet your goals as a marketer or someone, that's going to take time. That's going to be taking 8 to 10 to 12 visits or 10, interactions, and you better believe you're going to have to load up and have a whole bunch of accounts to meet that, those projections that you have for yourself, for the company, whatever it may be. So take your time. Take your time. Oh man, my breath was kicking, so I had to come to CVS real quick. You can't talk to people with a smelly mouth. Got my cologne and everything. Everything is fine, but look to par. Got my blazer. I usually wear that whenever I'm talking to a doctor or having an important meeting. It's professional. Appearance is everything. First impressions are everything too. Usually wear an undershirt, so I sweat a lot, so I gotta wear an undershirt or else I'll be sweating even more. So yeah, I gotta get my mouth right. Oh, yeah. Long day, just finished for the day. About to head home now. Marketing was good for the day after I finished up the marketing. Came back to the office and helped some of our team process some hospice referrals. And then had a couple meetings. So yeah, it was a busy day. It was a good day, but it was a busy day. Yeah, I actually talked to a UTD marketing group, and we actually talked about marketing, which is kind of funny because we're just talking about it. And what we literally talked about was, when we talk about, I told them the example of a no turning into yes, right? So I didn't talk about this earlier, but when you say no to someone, it's not a rejection. You're actually saying no and making a decision, just like based off of the need of that person. So a clear-cut example is like, okay, you're deciding whether or not you want to eat something. You're deciding based off of the taste. You're deciding based off of like what you're hungry for at that moment, but also you're deciding based off of, the customer service that you may have. So if you want, Chinese food, or you want barbecue, just might be depending on the taste. It doesn't mean you're rejecting barbecue or rejecting Chinese food based off of what you decided to eat. It's just a decision. Same thing goes with marketing and sales. Their decision is not a rejection, it's a choice at the moment of their need. So your job as a marketer, as a salesperson, is to ensure that you help them make the best decision for themselves, and they'll remember you. And when they remember you, maybe you can help them with another choice, and maybe that choice will become a yes one day in the future. So it was cool. I helped them understand. I'm gonna talk to them live and in person, talk to some interns and some students about what it means to be a marketer. So yeah, as you're going out there and marketing to people and taking care of them and serving is the number one job to do when it comes to marketing. Make sure you're helping them make a good decision that helps solve their problem for themselves. Have a good one, guys.